I'm Dave Mullins. I'm a podiatric surgeon and healthcare attorney in Northern California. I'm also the author of the book, How to Win Medicare Appeals, published by the American Bar Association. This podcast is based on that book, and this is episode number 2 of the podcast. Let's get started. Where do you find the rules for Medicare appeals? You find them in the 42 CFR, where CFR stands for the Code of Federal Regulations. The rules start at 42 CFR section 405.900 and end at 405.1140. Are the 42 CFR code sections easy to understand and easy to apply? Not a chance. These code sections are written in legalese, and that's not by accident. But when you're in the middle of an appeal, you need a clear explanation as to what to do next and exactly how to do it, all in plain English. That's why I wrote How to Win Medicare Appeals in plain English. Can a Medicare administrative law judge rule in defiance of a 42 CFR code section in order to award payment of your claim? No. The CFR code sections have the weight of federal law, and the Medicare ALJs are not allowed to rule in defiance of federal laws. However, the ALJs can rule in defiance of a local coverage determination rule published by a Medicare administrative contractor. How are 42 CFR denials of appeals different from LCD denials of appeals? Well, generally speaking, the 42 CFR denials are procedural. For example, you submitted your appeal after the time limit had already run for submitting the appeal, whereas the LCD denials are substantive. For example, the LCD states that a specific type of radiation therapy is not allowed for the treatment of prostate cancer, but your radiation oncology client used that form of radiation therapy, and therefore the claim was denied and the appeal is denied. Should every Medicare denial be appealed? I think the answer is yes. The provider simply cannot afford to voluntarily surrender the already reduced amounts that they're receiving for treatment of their Medicare patients. You'll notice at the bottom of this slide that I'm giving you the reference for the page number of the question and answer sets from How to Win Medicare Appeals that explain the answer to this question in greater detail. We're going to be doing that frequently going forward. How are we using the term provider in this podcast? If you look at 42 CFR section 400.202, what you'll see is that Medicare defines a hospital as a provider, and Medicare defines a doctor as a supplier. But for this podcast, we're going to use the term provider to mean anyone and everyone contracted with Medicare for services provided to Medicare patients. And for this podcast, we're going to use the term services to mean goods and or services provided to Medicare patients. Why would billing companies and billing departments for Medicare providers welcome anyone proficient at Medicare appeals? Because going forward, they will never have to give up after the first level appeal. They will never waste their time and effort on another incompetent second-level reconsideration appeal, and they're never going to have to write off another Medicare denial as the, quote, cost of doing business. I frequently have Medicare providers tell me at various medical meetings that they don't bother to appeal their Medicare denials because they figure they're just the cost of doing business. I usually wait a beat or two, and then I smile and say something like, okay, when your overhead expense exceeds the amount that you're receiving for the care of your patients, give me a call. They don't like that response, but they sure get the message. And frequently, I've gotten that call. How should you structure your fee agreement with your Medicare provider clients? Let's take an example agreement. Let's say that you get 40% of the Medicare allowed amount. The billing company is going to get 10%, and the provider gets 50%. I would tell you that 50% of the Medicare allowed amount for the provider is a whole lot better than 100% of nothing. And I would also tell you that that billing company no longer has to waste their time, therefore waste their money, incompetently pursuing their Medicare denials. Now that billing company realizes the only thing they have to do is to pick up the phone and call you. And you are going to do those Medicare denials for them. Why should you always make sure the billing company gets the same percentage they would have received had that claim been paid when the claim was first submitted? Remember that advertisement on television where they said, "Got milk?" Well, I would ask you, got clients? Because the billing companies have lots and lots of clients, and there's no reason why those clients shouldn't be your clients. How are you going to get your first provider clients? This is kind of obvious. You're going to tell the billing manager at the hospital, at the surgery center, at the radiation therapy center, at the physical therapy center, at your medical office or surgical office, you're going to tell the person in charge of billing, I want to appeal the denied Medicare claims that you're not going to appeal. The denied Medicare claims you're going to write off as losses and throw in the garbage. And I'm willing to do this on a contingency fee basis, meaning if I don't win, I don't get paid. There isn't a billing manager in the world who's not going to take you up on that offer. Why do I think it's not only possible but probable that many of you will be doing Medicare appeals during the next 6 months to a year? Because nobody's in a better position to do Medicare appeals. Because you already have all, if not most, of the skill set necessary to do Medicare appeals. And because Medicare denials are only going to become more frequent and more expensive. Is the light going on here? I sure hope so. Because Medicare appeals are easy to do, because they're cost-free to do, because they allow you to backfill your schedule every day, because they allow you to build your client base going forward, and because there's nothing wrong with making money. That's it for today. I'll see you next week.